Good afternoon, everyone. We're just at the top of the hour, so we're going to go ahead and get started. And I'd like to start by first thanking all of you for joining us today. We're so thrilled to have so many of you on the line with us and for this opportunity to share information about the new chronic disease care program at AmeriCares. We have launched the first initiative under the CDCP and are now accepting proposals for the Transforming Prediabetes Care Initiative. And this is really designed to be a national demonstration for free and charitable clinics focused on addressing prediabetes in the patients you serve. What we hope to do in our time together today is to provide an overview of the initiative and cover some key areas that will help you determine if this is a good fit for your clinic, and also to answer any questions you may have about what participation in this means for you.
So I'm Christina Newport, Program Manager at AmeriCares on the U.S. Medical Assistance Team. And I'll be overseeing the implementation of these new initiatives, and will also have the pleasure of working directly with the clinics that are brought on board to participate. Also on the line with us today are Leslie McGuire, Vice President of U.S. Partnerships and Programs at AmeriCares, and Dr. Julie Darnell, Assistant Professor and Researcher at the University of Illinois at Chicago, and a key collaborator working closely with us on the development of this program. So you'll be hearing from Julie a little bit later on in the webinar today. There are just a few logistics I wanted to review before we get started. As you probably noticed when you entered into the webinar, all of the lines are muted and will remain muted during the presentation. If you are connected to the audio through your phone, be sure to enter the audio code that's shown in the panel on the right-hand side of your screen, and you can enter that audio code at any time. This will allow you to ask questions when we get to that live portion of the webinar. Speaking of questions, we hope to leave plenty of time for them at the end of the webinar, but if we don't have a chance to get to all of the questions that are submitted, we will be sure to follow up with you to make sure they're answered. Because there are so many of you joining us today, what we're going to ask everybody to do is actually submit their questions by typing them into the questions area on the panel. Those will get sent directly to us. We will then unmute your phone so you can ask your question, and the system will alert you when your phone has been unmuted. One final thing, too, is that we are recording today's webinar. Because we will be sharing so much information with you today, we wanted to be sure to make it available as a resource that you can go back to, but also for any folks who aren't able to join us. So we realize that there may be some of you on the line who are new to AmeriCares, and think it's always a nice way to start by giving a quick overview of who we are as an organization and just to give you a sense of our work. So AmeriCares is a nonprofit global health and emergency response organization, and the work that we do centers around a strong commitment to saving lives and improving health for people in crisis or for those with limited resources. And it's really in the DNA of our organization to respond to those that are in need. We were founded in 1982 and since then have delivered over $11 billion in aid. And that aid is delivered not just in times of emergency or disaster, which is really a big part of our work, but also through the ongoing partnerships and relationships that we develop and cultivate with organizations around the world. We work to deliver on our mission to help those in need by expanding and restoring health services and access to health care, relieving shortages of medicines and medical supplies, providing quality primary care through our own AmeriCares free clinics that we operate in the state of Connecticut, and also to work to bring about long-term improvements in healthcare delivery. And our model is structured in a way that we have relationships with and receive product donations from more than 200 corporations, from vaccines to diabetes meds to antibiotics and medical supplies. We then make those products that are donated to us available to our local healthcare partners to enhance their service delivery and the quality of care that they provide to patients. We work to ensure that all of our product donations are also strategically allocated to be able to maximize the impact that they have, and are proud that for every dollar that's donated to AmeriCares, we are able to provide $20 in aid. The U.S. Medical Assistance Program at AmeriCares is really the program that this initiative falls under. And in the U.S., AmeriCares is the largest provider of donated medicines, vaccines, and medical supplies. We have more than 650 partners throughout the country. And the focus of our work is on those that are poor and underserved to be able to expand their access to care, enhance treatment, and improve health outcomes. So the donations that we receive and donate to our partners can then be distributed to their patients who are under 300% of the federal poverty level, who are uninsured, or for those that are underinsured that can't afford their medications, and they're provided at no cost. Through the U.S. program, we're always also looking for ways to support and be a resource to our partners. So with that, we maintain and update on a regular basis our website, safetynetcenter.org, where we post a variety of tools and capacity-building resources specific to the safety net. We are also really involved and help to facilitate emergency response efforts here in the U.S. So when there are emergencies or disasters happening here in the country, we are actively involved and reach out to our partners on the ground to help facilitate response efforts in the local areas. And all of this is established and sustained with support from the GE Foundation. They're really committed to enhancing the capacity of the safety net, and we're fortunate to have them as a strong supporter of our work here in the U.S. So the remainder of our talk today will focus on the Prediabetes Initiative, and this is why you're all here, to go over the key details of the program. And I'm going to ask you to try to hang with me for this whole hour because there's a lot of information to share, and we want to make sure to get it all to you. So we'll spend some time going over the details, and we'll also talk about the evaluation we'll be doing of this work. So you'll hear from Julie Darnell around the research design that we've put together to give you a sense of the type of data we'll be collecting and the measures that we'll be looking at as part of participation in this program. We'll also discuss the clinic eligibility criteria we laid out in the request for proposals. We'll discuss the application and proposal process. And then finally, we will review some activities that will occur over the next few months for clinics that are chosen to participate. So just to give you kind of a snapshot forward of the things to come if you are accepted into the program. And of course, again, hopefully plenty of time for questions. So you all know and experience every day the problem and prevalence of chronic disease in the patients that you serve. So the Chronic Disease Care Program is really the overarching strategic framework for the efforts that we are launching, with the overall goal to support and build capacity in free and charitable clinics, and to provide tools and coaching support to clinics not only to address but also to potentially prevent chronic disease and to impact the health of patients. So with that, there are two initiatives that we'll be launching, prediabetes, which you're here to learn about today, and then later this year, we will be launching the Transforming Depression Care Initiative. So there will be a similar application and proposal process at the time that we launch. We'll probably hold a similar webinar to share details about that program. But there will be another initiative and funding opportunity for clinics coming later this year. So stay tuned for more information on that. Across both of the initiatives, one of the primary drivers is to gain a better understanding of how these efforts work in free and charitable clinics. And we want to be able to showcase what clinics can do as a group and the quality of care that you provide. So we plan to share the findings of our work through this initiative with the larger free clinic community to be able to serve as a model for adoption for other clinics in other settings, and also to elevate the work of the free clinic sector. So to that end, we will be doing an evaluation of this work that will be led by Julie at UIC and have plans to disseminate our findings. And again, just to let everybody know, this program is also funded by the GE Foundation as well. So you may be asking, or curious as to why we chose prediabetes as one of our focus areas. And the reason is because that prediabetes is a preventable health condition. It impacts millions of people, and it increases the risk that somebody will develop type 2 diabetes or other health conditions. So focusing in on this is really an opportunity for clinics to prioritize a major health problem that's often overlooked, but that impacts such a large portion of patients. And the goal, and what we're really trying to get at, is to increase the identification of prediabetes among patients, creating an opportunity to intervene early, teach and apply lifestyle skills and changes that can really have an impact on the trajectory of the disease. It's also to improve the health and quality of life for patients, and an opportunity to shift the focus toward prevention. So what I want to do now is kind of take you step by step through how this will work, and then as we go through the slides, we'll get further into some of the specific details. So this is a 2-year commitment, and we will be selecting 7 clinics to participate in the initiative through an application and proposal process. The resources that will be offered by AmeriCares include a $10,000 grant, so you will receive $5,000 a year, a laptop to help with some data collection and reporting processes. We'll also be offering patient incentives, and we will be covering the cost of training for 2 people from the clinic to receive formal training on the program we'll be implementing. The grant funding that we'll offer can be used as the clinic sees fit, but we will ask in the application how the clinic plans to use the funds. So one of the first pieces to think about and really develop a plan around is who from your clinic can serve as the lead on this initiative, or the prediabetes care manager or lifestyle coach is sort of the title that we've identified. And the reason why we have it plural here is because, as I just mentioned, we will be selecting 2 people, or the clinic will select 2 people to receive training. Ideally, one person would be identified as the lead, and the other person can help to support or fill in if and when needed throughout the duration of the grant period. Those 2 folks will receive formal training on the Center for Disease Control and Prevention's National Diabetes Prevention Program. So this is an evidence-based intervention that targets lifestyle changes. The training is a 2-day in-person training that will be held at our headquarters in Stamford, Connecticut, and it covers the Diabetes Prevention Program curriculum. So this is a predefined or set curriculum that was developed by the CDC. It also covers what clinics need to know in order to facilitate these classes on site, and techniques and skills like facilitating group sessions. So it's a really dynamic, interactive training that the people from your clinic will participate in. The Diabetes Prevention Program classes are designed to be delivered in groups, and the group sizes can vary. They can be anywhere between 10 and 20 patients, ideally. So clinics will have to run multiple groups over the course of the 2-year grant period. After your staff receives training and they're back at the clinic and ready to go, a process must be established to identify, who the pre-diabetic patients in your clinic are, and then to begin to recruit and enroll eligible patients to participate in the program. There are a number of eligibility criteria as it relates to the patient, but generally patients have to be over the age of 18. They have to have a BMI over 24 and have either a blood-based diagnostic screen that indicates they're at risk for type 2 diabetes, or they have to screen positive on a paper screening test. Once your clinic is ready for implementation, the Diabetes Prevention Program consists of 22 sessions over the course of the program. So it's kind of split into 2 distinct groups. The first is the core sessions. So these are 16 weekly sessions that are designed to be delivered consecutively. And then after you get through the 16 core sessions, there are 6 post-core sessions that are designed to be delivered on a monthly basis thereafter. The goal of the DPP is to focus on weight loss and increasing physical activity in patients. And when Julie talks about some of the goals and data pieces that we'll be collecting, she'll talk in more depth about the specific targets for these. Though the focus is weight loss for patients, the program is really positioned as a lifestyle change program. So it's why it is spread out over the course of the 16 weeks, because we know it takes time for people to make changes. And so, the classes are designed to be delivered in a consecutive basis to really move people through the process of change over that time. In addition to implementing the curriculum and delivering that to patients on site, clinics will also be asked to report data on an ongoing basis, and we will be providing a web-based system to allow for easy reporting. Because this is a CDC program, one of the nice pieces is that clinics will also have an opportunity to receive recognition through the CDC for implementation. And this is something that AmeriCares can help support as you're participating in the program. The other unique thing about the way we've set the program up and about participation is the ongoing coaching support and technical assistance that clinics will receive throughout their participation in the initiative. So we will provide and offer regular phone calls, webinars, on-site visits, educational opportunities, and kind of work really closely with clinics as they go through the process of implementation. So in large efforts such as this, I always am a strong believer of the need to have the right people in place to help support different elements. We're really fortunate to have some really great partners contributing to this effort. And we just wanted to mention these now so you have an idea of the other entities involved. So we have a formal agreement with the American Medical Association. The work that we'll be doing through this prediabetes initiative is completely aligned with their strategic focus on improving health outcomes, which aims to reduce the incidence of prediabetes in the United States. So the AMA will be contributing by providing their expertise, tools, and resources that we can then make available to the participating clinics. We'll also be contracting with one of the 2 certified master training organizations that provide lifestyle coach training on the diabetes prevention program. I've already mentioned Julie several times from the University of Illinois at Chicago, but really can't stress enough how fortunate we are to have her working so closely with us on this initiative, and she'll be overseeing the evaluation and the research that we'll be doing. Julie's experience in and passion for working with free and charitable clinics is so invaluable, and so we're just really lucky to have her involved with us on this. So we certainly recognize that the program and the implementation of the initiative is a big undertaking and commitment for clinics with all the work you're trying to do and accomplish in your day-to-day and in the changing landscape of healthcare. We certainly recognize that there is a lot going on, and this is another element to add. So we felt it was important to highlight some of the key benefits to your clinic participating, aside from the monetary resources we'll be providing, which we've talked about, and we've touched on some of these pieces already. But I think first and foremost, the initiative and the way that we've structured it is really designed to elevate the work of free clinics. So we really want to be able to showcase, what clinics that come together as a group are able to accomplish. And because clinics will be participating in this as a national demonstration, it could really help with advocacy efforts on multiple levels. This is also an opportunity for clinics to participate in a research study and contribute to the literature. So it's a chance to show that free clinics can be an ideal setting to do research in and could potentially open doors for future opportunities. We'll be seeking publication in peer-reviewed journal articles, so it's also to have a chance to have your clinic identified in a published paper. AmeriCares will also monitor the implementation. We'll hold regular calls and webinars, as I mentioned. And in my previous experience, I worked as a healthcare quality improvement coach. And so one of the things that we really hope to be able to do is offer ongoing coaching support, offering strategies and skills around quality and performance improvement, and to really work hand in hand with the clinics that will be participating. What we also hope to do is foster and cultivate a learning community. So giving regular opportunities for the 7 clinics that are chosen to get together and share with the other participating clinics. So sharing best practices and talking about what's working, what's not working, and just sharing ideas with each other. So we really hope to be able to provide a platform in order to allow that to occur. And finally, I think another piece to highlight here through the bullets on these slides is that the skills that you learn, like using patient registries and motivational interviewing, which are things that will be covered in different elements and parts of the training, are definitely transferable to other areas of chronic disease management. So even though this initiative is focused on prediabetes, the skills you learn can definitely be applied to other areas. So I realize I'm shifting gears just a little bit, but still sort of on the topic of important resources for implementation. So a key element that we identified pretty early on by talking with a number of free clinics is that patient engagement can certainly be a challenge. And having something to offer patients to encourage participation and engagement is really important. So what we've done is we were able to put together a plan that will allow AmeriCares to provide incentives for the first 5 classes. So, and that's for a total of 60 patients. And this is, in addition to the grant that we'll be providing. So what we know is that for earlier classes, especially, incentives can be critical to getting, patients involved and securing their participation. At a certain point, I think group dynamics begin to take over and patients are interested and they begin to come to the classes for each other. But I think, having some incentives at least secured for the first few classes will help. Clinics are still encouraged to secure additional incentives for patients. Because we are doing research, having some standardization around the incentives that are provided to patients for the remaining sessions is an important piece. So what we've done is we've put together a document that's available on our website, and we'll provide the link a little later in the slides, that provides some guidelines around incentives and how to offer incentives to patients and ideas around what types of incentives can be offered. Some of the key guidelines that we've identified is that, clinics are certainly welcome to use the grant funds that we'll be providing to purchase additional incentives. Clinics are encouraged to, and I know are often very resourceful at seeking or requesting donations for incentives. And we also, in the document we created, provide a chart that talks about the types of incentives you might consider offering to patients and also suggests a maximum value to spend per patient to ensure that you're kind of staying within those guidelines. And so I just wanted to mention this piece as part of this presentation because there is a question in the application and proposal that asks about this specifically. So it's just something to think through as you're developing a plan. Another key element to think through are your plans for who will fill the role of your lifestyle coach. So the lifestyle coach or coaches are really instrumental to the success of the initiative. They really help to guide people through the process of change, so it's critical to identify the right staff person to fill this role. So we have created a document also available on our website that lists out not only the responsibilities of the person taking on this role, but also key characteristics to look for in the person who will lead these efforts. The CDC also has a detailed document and even sample job descriptions that we provide a link to in our document, and I strongly recommend or encourage you to review this to kind of think through who might fill this role. A couple of the key characteristics just to highlight here is that the person has some strong interpersonal and communication skills. So, they will be responsible for leading groups, leading people through the process of change. So it's important to have somebody who is, comfortable in front of groups and kind of facilitating that whole process. I think it's also really important that whoever you choose for this role has exceptional attention to detail, and for the data collection piece, this will be especially important. One of the other things to just think through and consider is that a good amount of time is actually spent in between the classes. So prepping before each class, reviewing food logs of participants, providing feedback, reaching out to patients for reminders before the next class. So I think it's a nice complement to have two people that can focus on preparing and making sure that everything's in place in between each of the sessions. And this is also something, another question that we ask about on the application. So just wanted to point out the tools and resources that we've developed around this that might help you as you think through this piece. So with that, I'm going to pause here, and I'm going to turn it over to Julie, who will talk a little bit more about the study design and the data collection piece.
See that there, wanted to echo Christina's remarks to say how thrilled I am to see so many clinics interested in learning more about a research project. I think what's novel about our approach is that we really know almost nothing about the effectiveness of the DPP program in the free and charitable clinic settings. In our work leading up to this webinar, we've identified only a single free clinic, a clinic that is located in Louisiana, that has implemented the program. So there's a lot more to learn about free clinics' effectiveness in prediabetes care. We are following the CDC's aims and focusing our attention on three primary outcomes, and their participation, weight loss, and physical activity. And again, we're following very closely and aligning our program with the CDC standards and are defining success in terms of levels of participation based on the CDC definition, which they use as participants who attend at least 9 sessions out of the ones that Christina mentioned, the 16 core sessions and the 6 post-core sessions. So it's 9 out of the initial 16 core sessions. But, and this makes the accounting a little easier to achieve, they don't count somebody as a participant unless they've attended at least 4 sessions. So the denominator would be participating in 9 sessions among all of your participants who at least attend 4. And then the way that we're measuring weight loss, the goal that we'll be striving toward is to achieve an average of a 7% weight loss among participants in the program, as well as 150 minutes of weekly physical activity. Beyond the CDC's primary outcomes, we're interested as well in tracking whether or not participating in this program leads to any changes in clinical biomarkers and quality of life. In terms of the patients, we arrived at a goal of enrolling 60 patients over the 2-year grant period because that was those are the numbers needed in order to do the kinds of statistical analysis that would be required for a research study of this nature. And I think many of you had posed some questions about why are we focusing in on English-speaking patients. Well, part of the answer to that question is because of some of our research interests in trying to limit the variation across the patient, across the clinics, because in order to carry out the statistical analysis, we have to pool subjects across the clinics. And recognizing that this project is fairly small, it's 7 clinics, we wanted to maximize our ability to be able to pool subjects and learn from those that participate. And we also are recognizing the limitations of our resources and just the additional challenges of having to translate all the materials into a second language, I think is just beyond our abilities. So for those reasons, we've had to limit the patients to those who are comfortable speaking English. We will be providing you all with the scripts and tools for recruitment, and we recognize that you would have to carry out multiple group sessions in order to reach that target number of 60 patients participating in the program over the course of the project. And we're requiring all clinics to have to track all of these patients over a period of 12 months. I'm ready for the next slide. Okay, let's look a little bit at what the kinds of data that we're asking you to collect. The baseline measures that we're asking clinics to collect on all of the patients who are eligible is in an effort to capture the vulnerability and to recognize the fragile disease states of your patients. So we'll be capturing patient demographic information, information about their health literacy and their visit history, a readiness standard. We're using the patient activation measure to assess patients' self-efficacy in this area, as well as a number of clinical measures. And our need to capture this clinical information led us to also require that the clinics have some ability to extract these kinds of data through an electronic medical record system or something that could be used to extract clinical information. Throughout the course of implementing the project, clinics will be reporting data about patients throughout the course of the study. At each session, the coach or the coach's helper will be helping to collect information about attendance, each subject's current weight, whether or not they filled out their food logs, and their physical activity for that week. On a monthly basis, we're asking clinics to report to us waist circumference. At 6 months, we'll collect some of these clinical measures, as well as revisit the issue of readiness, the self-efficacy, and then the final data collection endpoint is at 12 months. And this is where we hope to be able to show that the subjects who participated in the intervention have reached the goals set by the CDC of 7% weight loss and 150 minutes of physical activity. We'll be using a web-based tool, still to be determined, that will help to support your data collection efforts. And we'll work with you in providing technical assistance on how to collect data, providing webinars and also trainings to show you how and to support your data collection efforts. These data will also be de-identified and submitted to the CDC, and that paves the way for clinics to be recognized by the CDC for participating in this program.
Thanks, Julie. Appreciate that, and was really helpful to get that overview. So we have just a few more slides to get through before we open up the line for questions, and we wanted to spend a little bit of time kind of going over the clinic eligibility criteria that we identified in the request for proposal. So we've gotten a number of questions about these, and so wanted to just take a little time to go over some of the key points. And the first has to do with the first two bullets. So, you know, that the clinic is a 501c3 and a free and charitable clinic, and also that they provide essential services regardless of the ability to pay. So we understand that because of healthcare reform, many clinics are adopting a billing model. Clinics that bill Medicaid or Medicare can still apply for the program, but they must still provide essential services regardless of the ability to pay. And if you know, a clinic that is currently billing does want to apply for participation, the intervention and the patients that are enrolled in the study must only be delivered to uninsured free clinic patients. The next eligibility requirement that we got a number of questions on was the requirement that clinics provide at least 20 hours or more of medical care a week. And this requirement was put in place to get at really patient volume. So it's less about the actual numbers of care a week, but really more about the number of patients that your clinic sees. So in trying to explain this a little bit further, we estimate that about 10% of any patient population, about 10% is the prevalence rate of prediabetes, in any given patient population. So what we know from the literature is that about 20% of that 10% that are eligible will be interested in participating or will opt into enrolling into the program. So given those numbers, we estimate that clinics will need to serve about 3,000 unique patients a year in order to generate the numbers that are needed for the study. So that being said, if clinics can show that their prevalence rate of prediabetes is higher among their patient population, and also provide a rationale for how they will get to that 60 patient target, we are certainly open to reviewing their application and proposal. The next element that we've gotten a number of questions about is the requirement that clinics have an electronic medical record. And the reason why we put this in place as a requirement was to ensure that clinics have the ability to utilize an electronic system that will allow them to extract clinical data and reports on their patient population. So clinical data meaning things like their A1C and their blood pressure and their BMI. You know, so for example, once the program launches, clinics will have to go through a process to identify who out of their existing patients might be eligible for the DPP, which can be identified by a clinical data pull from their EMR. So, you know, we put this in place to really help with the data reporting, but also sort of the patient, the ongoing patient engagement piece. So with that being said, around the EMR, as long as you have an electronic medical record or another type of electronic system that allows you to collect and then pull or extract data on your patient population, we will certainly you know, be open to reviewing your application or proposal. So I think those are really the big pieces that I wanted to point out here in lieu of reading all of the bullets on this slide, but certainly encourage you to closely review all of the other eligibility criteria as well. And if there are more questions, feel free to submit those through the system, and we'll try to answer those when we open up the lines. So let's talk a minute about the application and proposal process. So all of the links that you need in order to get to the application are available in the request for proposal and also available on our website. So we laid out some key steps to completing your application, and the first one is to review the CDC's capacity assessment that helps to identify if the DPP is a good fit for your clinic. And we provide a link to that capacity assessment in the request for proposals that we sent out. We also encourage clinics to review all of the materials that we've been mentioning today and that are also available on our website, because the materials that we created and put together were really designed to help be supportive and resources for you as you start to think about how this might work in your clinic. The application is online, and it looks just like you see here on this screen, and we certainly didn't expect you to be able to read the snapshot that we provided, but this is the front page of what the application looks like. I wanted to mention that at the bottom of that front page, there is a link to download a PDF version of the application. So that way, if you wanted to take a look at the questions ahead of time or kind of plan out, what you were going to put in your application, you can do that by downloading the PDF version. But applications have to be submitted through this online system. There is a section toward the end that is really designed to be your proposal. So this is where we ask detailed questions about your plans to implement this in your setting. So that's where all of the resources we've developed will come into play and be really handy and helpful. This also may require some advanced conversations. And I wanted to just make a note here that there is a question in the application that asks if you have an EMR, and if you select no to that question, the application will automatically terminate. So there is an answer choice that will allow you to select no, but we have other systems, and then where you can provide some more detailed information about how you would be able to do the data pieces we were talking about earlier. So the deadline for proposals is September 22nd. And there is a place in the application where you can also upload some of the required documents that we have asked for as part of the submission. So one other document or piece that we wanted to cover is the timeline of activities. So again, this is a little bit of a snapshot forward for those clinics that are chosen to participate, and it lays out the key activities in terms of startup and implementation over the rest of this year and also the first quarter of next year. So all of the clinics that submit an application will be informed of their acceptance into the program or not by September 30th. You will receive the resources from AmeriCares sometime in October. We will have a webinar, we will establish some monthly calls, and we will kind of get everything in terms of the startup going in October and November of this year. We are also planning to do a lot of the training by the end of this year as well. So we just wanted to mention this to be thinking about the in-person training that we'll have held in Stamford, Connecticut. Will be in late October, early November. We'll also be doing some web-based training on our online reporting system and the IRB, as Julie mentioned, by the end of this year. And these are some of the other pieces that you see here on the slide that will be carried out. We have a document on our website that takes you through actually the 2-year duration of the program and the activities that are planned. Of course, this is always subject to change, but just to give you an idea of what to expect down the line. And we also expect at some point in the first quarter of 2015 to be able to make an on-site visit to your clinic to do some in-person work together. And finally, if I can find the materials and resources. So all of the materials that we've been talking about and mentioning, they're all available on our website through the first link that you see here on your screen. We have the RFP, the application, the timeline of activities, the staff roles. All of those documents are accessible through our website. We also wanted to make the link to the CDC's Diabetes Prevention Program site available to you as well. There, the CDC actually posts the entire DPP curriculum, so you can kind of take a look at the classes and what the topics are, but just to give you a sense of the resources that the CDC has available as well. So with all of this, we now want to open up the lines for question and answer. So just wanted to remind everybody that you can ask a question by typing in your question through the panel. I'm going to do my best to try to manage the questions we're getting and also unmuting people's phones so they have an opportunity to ask their question live.